Hi, my name is Brad Heineck. I'm a physical therapist, and what I'd like to do is talk to you about sit-ups. As a therapist, I get people coming in and say, geez, I want to work on my abdominal muscles and get that 12-pack, that six-pack there. And so sit-ups, as far in my mind, are probably one of the things that are done improperly. People are abusing their spines, particularly their neck, as well as their low back. They're beating their spine up from top to bottom doing their sit-ups. And as a therapist, we often work with core, or the stomach muscles, to help treat back pain and stabilize that core for numerous activities and numerous reasons. So I just wanted to go briefly over sit-ups, number one, how to do them, as well as how not to do them. Sit-ups. That is one way how not to do them. The old thing about putting the hands behind the neck and going forward and pulling on your neck to get that extra little push, what it does, it ends up stressing your neck in a big way. You work the muscles here, but you're sacrificing your neck as a result of it. Do not do sit-ups that way. The old-fashioned sit-ups when I was a kid was these. Go all the way up and touch your toe and all the way back. For the presidential award, we have to do this when someone's holding on to your ankles. That is not the way to do them either. It's probably better than tugging on your neck, but there's better ways to do it. What we're doing is working on the abdominal muscles right here. You got the rectus muscles, the oblique muscles, and they're all right here. And to make those contract and get an effective strengthening motion, you do not have to get full range of motion up to here and all the way back. We can do that simply by lifting our shoulders and shoulder blades off the ground and coming back and get good work on those trunk muscles, okay? So when you do a sit-up, what I like to do, this is one of the techniques I like to teach to my patients, is I usually have them bring their knees up like so, feet flat on the floor, not on a bed, but on a firm floor, a firm surface. Cross the hands across like this, and we keep the head straight. We're not doing this. Balancing your head up and down. We are keeping the spine straight. And as you can see as I talk, or you can hear as I talk, I should say, I'm working those stomach muscles good right now. Working the rectus abdominis. Okay, that's that six-pack that you're going to do. These are the ones that are going to really work those muscles. But remember, we need to work all the fibers of the muscles of the stomach. So I tell people, take the right elbow, bring it towards the left knee. Now, I'm not saying you have to go all the way up and touch the left knee. Okay, you can do that, but you don't need to. But we're going to bring it towards the opposite knee, and that's going to work those oblique fibers. Okay, so here, and I usually alternate it. Okay, you get both sides, and it just seems to work out better for most people. Again, the head's not going up and bobbing, trying to keep that cervical spine in a neutral position as we work those sit-ups. Okay, if you want to work the lower part of your stomach, then we can start working. What you want to do is, if you put your hand back here in your lower back, if you can get your hand back there, tighten your stomach muscles up. And this is hard to see, but I'm flattening my back right to the floor, and that keeps my back in a more neutral position, and we can start working knees to chest. Okay, this is where you start keeping that back flat on the floor the best you can. Okay, that's phase one. You want to make it a little more difficult, we can start going out like this. Okay, if that gets more difficult, and what happens is we call it their back will collapse and arch up if they're not strong enough. And if you feel your back arch up right in here, that can irritate your back. This is pretty advanced. You're not going to do this unless you got pretty good, very strong stomach muscles. Okay, so if you just start that, don't even consider that one. Those are just a few techniques that I like to teach and use. There are many more. The next thing I really like for trunk and core strengthening is right here, using the stability ball. These are very common. At one time they were used just by therapists, and as things have evolved, they're all over in every department store you can think of. And I'm just going to give one example on the ball. Arms here, and you simply work your stomach muscles just as if you were doing them on the floor. The nice thing about the ball is if I roll down to here, it supports a different aspect, different area of my back. It's actually a little easier here, so this is where you start. As you get more advanced and stronger, you start going back in here and you can work more range of motion. Okay? Now I have a video for this ball. You can go to our website at physicaltherapyvideo.com, and I have 2 parts on there, part 1 and part 2. It'll go through all the details on how to work abdominal muscles and more using the stability ball. Okay. All right, work my stomach muscles now. My heart rate is up a little bit, my body core temperature's up, and that's what's going to happen when you work them.